Hi, my name's Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. What we typically recommend are two options in terms of immunotherapy. So the old standby immunotherapy are allergy shots or allergy injections. Those treatments work very well for patients. Usually about 70 to 80% of patients will get significantly better with allergy shots. And we recommend typically that those allergy shots should be prescribed by an allergist. They can be given in your family doctor's office as well. And essentially what we do is we give the shot starting at a really small dose. And then every week or sometimes twice a week, you come into the clinic and we increase the dose until we get up to a maintenance dose. If you go weekly, that takes about 6 months. Once you get up to that maintenance dose, then it's stretched out to once a month. And we typically recommend staying on that type of treatment for about 5 years. We believe if you take it for 5 years and then stop, there's a prolonged protective effect. And some people will have no symptoms or at least significantly decreased symptoms for several years. We've actually had that type of treatment available for over 100 years. The drawback or drawbacks with the shots, there's a few of them. The biggest drawback is that there's a small risk of having anaphylactic reactions to the shots. Rarely these reactions can actually be life-threatening. So the shots have to be given in a doctor's office, and the doctor should be ready to go in terms of treating systemic allergic reactions. The other drawback is that you have to come in regularly. So you have to come into the office, typically wait a little while, get the shot, and then wait half an hour after the shot. So really, there's a time commitment with it. An advantage of that approach is that you can get multiple allergens in one shot. So typically, I max it out at 3 allergens per injection. So if you have more than 3 allergens, then typically you'll need 2 shots. Occasionally, we'll even have to use 3 shots. So again, it's important that you understand all of those issues before you start the shots. We typically recommend following our instructions in terms of how it's built up and how it's given. And there will be some specific issues that we'll discuss when we get consent from you. The newer option that we have available in Canada is now called sublingual tablets. So we call it SLIT. And we have those tablets available for dust mite allergy, birch allergy, grass allergy, and ragweed allergy. So 4 different types of allergens. And for dust mite, we take it all year round. But for the other allergens, typically we start the tablets about 3 months before the season, and you take it right through the season. The advantage of the sublingual tablets are that you take the first dose supervised in the doctor's office, and then you take it every day at home. The main drawbacks are it's more expensive in terms of out-of-pocket or drug plan expenses for the tablets versus the shots, and also you have to take the medication daily. There are some side effects where you can get local irritation that's usually mild and relatively short-lived. Rarely, some people can actually get allergy of the esophagus, so we recommend that you don't eat or drink right after taking the tablets. But the big benefit is that there's a very small risk of anaphylaxis, so we actually allow you to take them at home. Typically, we recommend taking those tablets for 3 to 5 full years or 3 to 5 full seasons with the allergens. And we believe after that time that there's a prolonged protective effect. These drugs should be prescribed by your allergist. And again, subcutaneous immunotherapy, which are the old allergy shots, which are still excellent and effective, and then sublingual allergy tablets that work for the 4 allergens that I mentioned: birch, grass, ragweed, and dust mite. If you're interested in those treatments, then you should talk to your allergist about that. In our clinics, we would encourage our local patients to get the shots in our clinic, or if they're out of town, or if it's more convenient for them to get the build-up and maintenance dosing in your family doctor's office. Thank you.